Different inhaler devices suit different people. Asthma inhaler devices can be divided into 4 main groups: pressurised meter-dose inhalers, breath-activated inhalers, which include meter-dose inhalers and dry powder devices, inhalers with spacer devices, and nebulizers.
Preventers are often called the cornerstone of asthma therapy. In other words, they are essential in all types of asthma, even if other therapies are added to them and are needed daily to treat and control asthma symptoms. Think of preventers inhalers like suntan lotion. They're used regularly to provide a protective barrier, reducing inflammation, sensitivity and damage. But instead of protecting the skin, preventers are inhaled and work in the same way inside the airways. They focus on long-term asthma control to prevent asthma symptoms and should be taken every day, usually all year round, even when there are no asthma symptoms. And just the same as when the sun gets hotter and temperatures rise, the more frequently suntan lotion should be applied. So should more preventative inhaler be used to reduce airway swelling and inflammation at times of increased asthma. More asthma symptoms equals more preventative needed. It's that simple. Reliever inhalers, similar to after sun, should only be used as and when needed to quickly soothe and relieve damage to pink sore skin. Relievers open up your airways during an asthma flare-up. They offer immediate relief by relaxing the muscles surrounding the airways, causing them to open. But, as the name suggests, they only relieve and cannot prevent asthma symptoms nor asthma attacks, so should never be used regularly to control asthma. Prevention is the best approach with asthma. Remember, the more asthma symptoms you have, such as coughing, wheezing, tight chest or difficulty breathing, the more preventative treatment is needed to control your sensitive inflamed airways. Do not just increase the reliever without increasing your preventer therapy at the same time. If you are suffering from sunburn, you wouldn't just use more after sun and still sit in the burning heat, would you? You would prevent further damage by using a higher protection factor cream and remove yourself from the bright sunshine. It's that simple. Picture long-acting bronchodilators as airway stretchers on your lungs' highways. They help keep the roads open wider for a longer time, making it easier for you to breathe. These medications work over an extended period, preventing the airways from getting too narrow and making your respiratory journey smoother. It is important to remember that long-acting bronchodilators should never be taken alone for the treatment of asthma, but must be used in conjunction with inhaled steroids. Think of a combination inhaler with maintenance and reliever therapy like having a dual function tool. The maintenance part is like routine maintenance for your airways, keeping them in good shape. The reliever part is like having a quick fix tool for sudden issues. It helps open up your airways when you're experiencing symptoms. It's an all-in-one solution to keep your breathing steady and address any unexpected challenges. These inhalers contain both inhaled steroids plus long-acting bronchodilators. Imagine your airways are roads, and sometimes there's traffic causing congestion. Montelukast, otherwise known as Singulair, works like a traffic controller. It helps keep things flowing smoothly by preventing certain substances that create roadblocks. This way, it eases breathing for people with conditions like asthma by reducing inflammation and constriction in the airways. Imagine theophylline as a gentle traffic controller for your lungs. It helps relax the muscles around your airway, opening them up like widening a road during rush hour. This allows you to breathe more easily by reducing congestion and making sure air flows smoothly through your lungs. Think of injectable biologics for asthma as superheroes in your body. They target specific troublemakers causing inflammation in your airways. By neutralizing these culprits, the biologics help calm down the overall response, like superheroes restoring peace. This helps to prevent asthma symptoms and make breathing easier over the long term. They are usually only ever prescribed as an additional treatment to all the inhaled medication and possibly theophylline, so are reserved for those who have very difficult to control asthma.
Subscribe free of charge to see more.